Hello, I bring warm greetings from Narayana Health City. I'm Dr. Anil Kumar Sapare. Today's topic of discussion is wheezing in children. Is it asthma? I would like to inform that wheezing is a musical sound that you hear from the children when they're breathing out. It's a whistling sound whenever child is breathing out, and that particular whistling sound is called wheezing. This particular whistling sound or a wheezing is a sign of narrowing or obstruction of the smaller breathing tubes in the lung. Next question is, whenever child is having wheezing, does it mean is it asthma? Not necessarily. This wheezing is due to multiple reasons. It could be a problem with the structural problem of the breathing tubes, what we call trachea, bronchi, smaller tubes, and there is an entity called tracheobronchomalacia. Some of the children aspirate foreign bodies like peanuts or other objects into the airway. That obstruction can also produce this type of wheezing sounds, and sometimes some recurrent infections and conditions in the lower respiratory tract can lead to this wheezing sound. However, if this wheezing is recurrent and associated with lot of coughing, which is more in the night time, and associated with breathing difficulty, and these symptoms are recurring on a regular basis, and if there is a seasonality to them, then it is most likely that it is asthma. How do you investigate these children? The tests are very simple. We do spirometry in children who are older than 6 years, and other specialized test called impulse oscillometry to see is asthma the cause of this wheezing. With appropriate diagnosis, this wheezing can be treated. If this wheezing is confirmed to be asthma, with appropriate investigation and correct clinical context, they can be very effectively treated with inhaler medications. And people worry unnecessarily about inhaler medication. They are absolutely safe. They are the standard of practice worldwide. They're extremely effective, and the wheezing responds beautifully to these medications. So please consult your pediatrician. If your child is having recurrent episodes of wheezing, it could be a sign of asthma or it could be a sign of underlying lung disease. Based upon appropriate investigation, your pediatrician can diagnose and manage. Thank you.